रागादिरोगान् सततानुषक्तान् अशेषकाय प्रसृतान्नशेषान् औत्सुक्यमोहारतिदाञ्जखान यो पूर्ववैद्याय नमोऽस्तु तस्मै।
My humble pranams at the lotus feet of Lord Dhanvantari, and pranams to all the distinguished dignitaries, delegates, and friends of Ayurveda who have assembled here. And finally, inside Ayurveda is a reality. The shloka that we chanted a few minutes ago to invoke the presence of the physician par excellence actually reminded us to be unbiased, in the way we do medicine, Ayurveda. In fact, to be unbiased in the way we live life, because that verse reminded us that we have to eliminate the emotional turbulences in our mind, the passion, and other, disturbances which cloud our consciousness and keep truth from being, seen in the right way. So today we have a galaxy of distinguished personalities from not only Ayurveda but modern science, modern medicine. And it's a great pleasure to welcome all of you to Inside Ayurveda 2013. So welcome. First of all, I would like to honor our chief guest today, Professor Abhimanyu Kumar. He's the director of the All India Institute of Ayurveda and also now the Director General in charge of the Central Council for Research in Ayurvedic Sciences. So may I request Dr. Anita to welcome Professor Abhimanyu Kumar and lead him to the stage. I wouldn't want to waste time at this moment to go into a long, elaborate introduction of our guest, because all that is going to happen in the sections that will follow suit. So I'd like to now invite Professor Dr. Daniel First, the eminent rheumatologist from the United States, the first person professor of rheumatology from the UCLA. I request Dr. Anita to welcome Dr. First and invite him to the stage. I'd like now to invite Professor Horst Zumthek. He's an eminent neurologist from Germany and has done significant contributions in the field of Parkinson's and multiple sclerosis. I invite him to come on to the dais. I'd like to now invite Mark Rosenberg, the director of the European Academy of Ayurveda and our friend and collaborator, to the stage, and I request Anita to welcome Mark and take him to his dais. Thank you. I welcome Professor Martin Mitwede, who's the head of the academics at the European Academy of Ayurveda, and he's a Indologist and Sanskritist also, and teaches Ayurveda. Welcome to Ayurveda. I now request Professor Ludwig Kronpass from Germany. He's a gynecologist and integrating Ayurveda into his clinical practice. Professor Ludwig Kronpass, please come on the stage. I now invite Professor Alex Hankey. He's associated with very important academic initiatives in the field of Ayurveda, being a physicist by training welcome Professor Alex Sankey. Now, I'd like to invite Olivier Talpain, a medical anthropologist, and we're looking into the way Ayurveda can be integrated into Western mainstream medical. I now request our beloved Managing Director, Sri Priyar Krishna Kumar, to come on to the stage. And finally, before I welcome myself, Dr. K.G. Ravindran, Medical Director of the Ayurveda Pharmacy. I request Dr. Ravindran to please come on. So inside Ayurveda is an attempt to bring good science into the practice of Ayurveda and also actually create knowledge that can position Ayurveda as, a credible system of medicine at the global scenario. I'd like to mention that inside Ayurveda we hope will be unique in setting standards for scientific conferences in the field of Ayurveda. It is not that we are not having scientific meetings and deliberations, but often we fail to, reach the kind of standards that would really make a difference for Ayurveda when it comes to, promoting it at a global level. So we have introduced several systems of scientific discourse of how, the abstract should be submitted. It's also going to be a learning opportunity for the young upcoming Ayurvedic generation, and we have made sure that at least 80% of the delegates who participate in Inside Ayurveda will also be actively, presenting their research results, getting opportunity to be reviewed by, the experts in the field, and so that we hope that this will become a platform for, reaching out to still higher, platforms for presenting Ayurveda in a scientific manner. We are very happy to point out that the International Research Congress for Integrative Medicine and Health, which is going to be held in Miami, Florida next year, we are also going to preview some of the videos for this upcoming conference. I had attended the last conference in Portland, and it was really sad to see that Ayurveda is very poorly represented. In fact, Chinese medicine has a very strong presence, and it's very important that Ayurveda also kind of gets a strong presence and it conveys the message that it has to. And very sadly, many Ayurvedic physicians in the United States who attended the conference made presentations on Chinese medicine. So I think we really hope that these conferences will, give the kind of orientation that the youngsters need to be able to reach out to these bigger platforms so that we really have credible Ayurveda, on a global platform. So I'm also happy to announce that Dr. Robert Saper has come up with a proposal to collaborate with us. He has created a big controversy by writing that paper on heavy metals, but he's very much willing now to relook and have involved the Ayurvedic community in a new research project that he has offered to kind of take forward. And I think it's very important that we as an Ayurvedic community kind of collaborate and bring in the correct Ayurvedic perspective, so the myths and misconceptions regarding Ayurveda can be dispelled. So I think I'll cut short myself at this point. We have the eminent guests here to listen to, and a couple of events that we'll be releasing the first clinical research specialty journal in the field of Ayurveda, ASL musculoskeletal diseases, and we'll also be giving away the Best Researcher Award, which is a first of its kind activity in the field of Ayurveda to recognize and encourage good research work. So with these words, once again, I welcome all of you to this gathering here. I hope we have really a very good scientific conference in the coming 2 days. And this particular session, although we have some empty seats here, I'm happy to inform that this is being webcast online, live, and there are a lot of people who have logged on to the website to see what's happening here. So with that, a warm welcome again, and we'll now start the inaugural session. Thank you very much.
Most respected Professor Ayurveda Kumaji, other revered respected honored guests from other countries who have come here to bless us, who are men of high caliber of research and scholarship, other dear friends, my colleagues in the AVT group, a very warm good morning to all of you. To save time, I don't address individually to each of you, pardon me for this. I was just wondering yesterday, in the short span of 8 minutes, what do I speak to you? Founders of Ayurveda, the great rishis and saints, were men and women of farsightedness, hindsightedness, who through their extrasensory perceptions of highly elevated consciousness brought all this great material herbal wealth to all of us. Unfortunate that today's education system doesn't create any sightedness at all to us. So this is where we thought AVP was always stood for propagating this great knowledge of Ayurveda to all over the world, especially to the younger generation. Create opportunities for them to learn, meet masters as often as possible, learn as much as from them, have a dialogue with them, see how the best potential can be brought. These are days when we have young, brilliant scientists who would have normally gone for allopathy, come for Ayurveda. So the purpose of especially this AVT Research Foundation was to see how we could interact, and Dr. Ramano and his team very efficiently has been having continuous sessions, and all the material that has been developed through clinical great inputs from Dr. Ravindran being conveyed through the scientific language to the world outside, and as part of that is what this insight has been organized inside Ayurveda. I only hope and pray in this campus where Lord Dhanvantari resides, we will be able to open the insight, elevate the younger generation to a higher level of consciousness, through which they would be able to perceive more than the knowledge that they gain from dialogue and lectures, they would be able to bring it out from them. This morning, while fast asleep, I felt there was a light on my face. And it was wonderful to see opening the eyes, the moon right in front of outside. Today is a full moon day, a very special full moon day. And I'm sure the intention with which we started this conference will definitely achieve the great heights which we are working for. And especially with all these great eminent people who have come from far off distances, traveling long distance, especially Dr. First, traveling for 36 hours just to come and spend 2 days with us, guide us, and every sitting with him is something unbelievable. Yesterday I had wonderful sessions. He said there's a lot that we can do. A person who came first and said, I'm a purist. I'm neither for nor against. So you can expect only truth from me. And all of you know the research finding, along with whom we had wonderful interaction for the last so many years. Thanks to Dr. Manu also, who worked very closely with him, and he had no hesitation to say, yes, Ayurveda works. And now he has given us a lot more ideas as to how we could interact. But it's not possible just for ADP as such to start it. We need all you youngsters, all you scientists, we need all the other capable men and women from other institutes to join hands with us and make sure that Ayurveda doesn't continue to be an alternative system, but brings the main system not only for India, but the whole world. With these few words, thanking all of you for having come in and being here, especially Ayurveda Kumaji, with all your new responsibilities that you've taken over as Director General for the CCRS, Director for the new All India Institute of Ayurvedic Medicine. We only hope and pray to the Lord that you be blessed and take this great science to make sure that we have classic institutions like All Institute of Medical Science or Western Medicine. We will all be with you. I'm sure all these scientists here will also be joining with you for your research aspects. We have a large number of youngsters, and as Dr. Ramano mentioned, we are very keen. We don't need large number of people, but selected few who would be able to contribute for this. Thanks to all of you who registered, many of your friends who came, and have been spending and guiding us to help it. There are many others who will be joining us during the day and tomorrow for presenting their papers. I hope and pray the purpose with which we organize this conference will definitely be blessed by the Lord. Wishing all of you 2 wonderful days of sessions. Prayers to the Lord that all these great scientists continue to help Ayurveda to grow. Thanking them, all the best. Namaskaram, Jai Hind. Dhanvantari be all with all of you. Namaskaram. Thank you.
So this is the very first. And I must tell you, I expect all of you to subscribe and hopefully to put in some good articles as well. Thank you. Yeah.
We request Dr. K.G. Ravindran, Director, Ayurveda Pharmacy, to hand over the Best Research Paper Award to Dr. Supriya Bellero. The title is Prakriti, Ayurvedic Concept of Constitution and Variations in Platelet Aggregation, published in the BMC Complementary and Alternative Medicine 2012. The co-authors are Dr. Tejashree Deshpande and Dr. Urmila Datte. The award includes a cash prize of Rs 25,000, medal and certificate.
Honorable Sri Krishna Kumar ji, the real torch bearer of Ayurveda, sitting on the dais. Really, I just bow my head before you all, because I know that whatever we are doing here, sitting in the country, you are doing more than that, sitting at your place. So, thank you. I think on behalf of organizing committee, definitely I would like to thank you all. Learned audience sitting in the hall. We were discussing with Dr. Ram Manohar. So he suggested that why not to speak few words regarding new upcoming All India Institute of Ayurveda. So then we decided that of course everybody is having so many speculations about this institute, what will be the shape, how it will work, what will be the structure of this institute. So finally we decided to say something about this institute during this opening session. As we know that a lot of advancement is going on tremendously. So I would like to start with the quote of the Einstein. I fear the day that technology will surpass our human interaction. The world will have a generation of, I think it is not good to read the next word, you can see. But yes, This was the fear and the real fear of Einstein. And you know that because here everybody is having good faith in Ayurveda. So I assure you that whatever problem, it is not simply the disease condition. Any problem means even it may be your personal problem, you may get solution in Ayurveda. Of course, this is the beauty of this science. Because it is, of course, every time we used to say it is a science of life, that means it deals with each and every aspect of our life. So when this problem is there, I think solution is with Ayurveda. As we know that when there is a disequilibrium state, so Ayurveda believes that it should be in balanced form. So what will be the answer of this problem? Ancient wisdom. When too much advancement is there, of course, that is the reason why the advanced sciences, even the medical sciences, looking towards Ayurveda. I think that was the fear which was presumed by the Einstein. So the ancient wisdom. If you just put these two together, I think that is the best solution for mankind. So with this particular theme, the All India Institute of Ayurveda was perceived. We will have our ancient wisdom with a blend of modern technology, and that will be the way we will come forward. Because it will be a teaching institution, it will be a hospital, it will be a research organization, but ultimately we start with our students. And once our former President of India, Dr. APJ Abdul Kalam, said that when the students come out of the educational institutions, certain capacities are required to be built in them to deal with the real world, particularly to grow in their professional career and participate in the national development. I think exactly these lines used to fit to our Ayurveda graduate and postgraduate. So we have also taken care of these words from our former president. We are having a vision that All India Institute will be a center of excellence with global standards, offering Ayurveda education including evidence-based clinical practice and research opportunity of very high standard to the students, develop the total personality of the individual, whether it may be the student or the faculty, and instill high level of discipline and strive to set global standard, making our students technologically superior and ethically strong, who in turn shall contribute to the advancement of Ayurveda, society and the humankind. So with this, I think the experts of Ayurveda who are well aware about the conventional structure of any Ayurveda institution. So we are having little bit different composition. Though we will have all the departments, but those departments will be grouped into 4. We are more focusing over the referral hospital as a referral hospital and the clinical research. Referral hospital, not simply for a particular region, at the country level, and of course to attract the patients globally. Because sometimes we used to hear from our experts sitting in different corners of the world that if the patient want to get Ayurvedic treatment in India. So of course, in this part of country, I think this is again the best institution here where we are sitting. In the north, there should be, at least in Delhi, because as soon as you just land Delhi, so there should be one global standard institution which can take care of our international patients. So that level we want to achieve, and with that means the vision we are going to start. Of course, the safety and validity, that is a prime issue for Ayurveda drugs. So we are having very sophisticated drug standardization, quality control and safety evaluation division, as well as drug development and pharmacology division. Besides this, we are again fully concerned with fundamental research in Ayurveda, because any science can't survive if we just leave the fundamental aside. So our focus will be more with the research, fundamental research in Ayurveda. So this referral hospital will be of tertiary care level, and it will be dealing with the specialty and the super specialties. It will not have any undergraduate program. We are more focused with the postgraduate and the super specialty training programs. We are also planning some fellowship programs in area of strength of Ayurveda as a super specialty training program. The institute will be fully involved to develop the standard teaching and training material, because again, if you just go across some different Ayurveda institutions, there is a problem with the study material, the standard study material. So this responsibility the institute will take to develop such material. Of course, for everything, we will take the support of expert from different corners of the country. So right from beginning, I am very clear that this is All India Institute is not an institute of simply the government of India. It is an institute of every person who belongs to Ayurveda, who loves Ayurveda. So whatever suggestions you will put, it will be my pleasure to incorporate for the benefit, for the development of Ayurveda. So besides regular teaching, specialty and super specialty programs, our students will get the exposure of hospital and health management, clinical research, and of course the soft skills. The team of Ayurveda expert, modern medical doctor, and the basic scientist. So this is the beauty of the institute, that under one roof we will have the expert of all the three streams: Ayurveda experts, experts of modern medicine, and basic scientists. So this will be the trend, that learn to teach and teach to learn, and by this way we will strengthen the capability of our student as well as the faculty. Of course, several programs beyond the classrooms. The institute is affiliated with the referral hospital, 200 bedded. Of course, considering the extreme heat and the variation in temperature, so it is fully air conditioned, centrally air conditioned. And we are having several clinics in areas where the Ayurveda is having strength. We will develop special packages for the positive health, because again, when we go for the positive health, a lot of variation in approach is there. So there should be, we thought that there should be some standards to be followed, and in that way it will be easy for the persons to follow also. Clinical protocols, of course, again for Ayurveda it is said there is too much variation in treatment. Of course that is there, but ultimately we will try to minimize it so that our student can learn in a better way. And of course even any person or the expert coming from any corner of the world, and he may be exposed with certain standard treatment protocols. For drug standardization, drug research, of course, the beauty of this institute will be that there will not be compartments. The idea is that what is the basic need of the person who is sitting in clinic, depending on the demand, because the patients, that is the end user, and everything should be according to that. So what is the demand of a physician or the specialist sitting in a hospital? Accordingly, our drug development or a drug standardization division will work to develop the drugs, standardize the drugs, and accordingly our fundamental division will develop the things to offer. Normally what is happening means even the clinical person, they have to develop some protocol, they have to develop some skills by their own, then they go for the clinical research. And this used to hamper the pace. So this is clear-cut compartment of work, division of work, but things are quite linked with each other. So that is what is the demand of physician, ultimately that would fulfill by different units. So this is the unique approach. We are having a department of experimental medicine that will help various clinical departments to have an in-depth research at the level of molecular biology and basic science to correlate with the various clinical problems. Fundamental research, we will touch each and every aspect of Ayurveda to explore the things right from Panch Mahabhuta to development of Ayurveda diagnostic techniques, because you know that when we go for the diagnostic techniques, Ayurveda is having wonderful diagnostic techniques, so but those need to be validated. So this particular division will be concerned to validate all those issues in collaboration with basic scientists. The institute will also try to develop research network, because it is a team effort. So right from the country to every corner of the world, all the leading institutions, research organizations, universities, non-government organizations, every organization that will be taken care of by the institute to join hands. Again, this is a somewhat, you can say, the weaker area. We believe in work. Normally, if you just ask to any Ayurveda expert, he says, okay, I am simply concerned to treat my patient. I am not concerned with so many things, including to just get patent. But I think this is the need of power. And we have to train our faculty or student to just get some patent, because ultimately then we can grow. The institute is also having the planning to develop as a national nodal center for implementation of national clinical documentation and demographic study program. I think Dr. Ram idea behind this concept is working, because few years before he thought that if such type program is there, definitely we will have some data to show, because whether any government or any planning commission develops program for the benefit of the country, that depends on the data available with them. So thank you, Ram. We have just stolen your idea, but this is yours. I just declare from here, this is yours idea. For international program, of course, various short-term as well as long-term training programs on various areas of Ayurveda. We will have active collaboration with foreign institutions and the universities, that is on our top agenda. Faculty exchange program and preparation of literature for propagation of Ayurveda in foreign countries through Indian embassies. So I think that will help a lot. So this is a view of institute. Once fully function or established, the institute will have 25 specialty departments, 12 super specialty clinics with 50 interdisciplinary research laboratories. So this is the structure, facility, and what we want to have in this institute. It is there. So this is the broad outline of the structure of the institute. Then with several other things, and the quote says that the greatest medicine of all is to teach people how not to need it. I think Ayurveda fits well in this frame. So I can just say that All India Institute bring a synergy between ancient wisdom of Ayurveda and advantage of modern diagnostic technology and the management. So it is again, it will be a model center for international collaboration, and we believe in innovate, achievement, and to lead. So thank you very much. But before I just stop, again I invite your suggestions, because whatever means the idea is, whatever the vision is, it can't be fulfilled by few people. Every person of Ayurveda, whether he is sitting here in this room or belongs to this country or belongs to any country of the world, I will request them to just offer their help. And any time when they are having any suggestion, you are most welcome. And without that, I think it would be not possible to touch that level which we perceive. Thank you very much for the organizing committee to giving me this opportunity to share my views, especially regarding the upcoming All India Institute of Ayurveda. Thank you very much.
We really wanted, one of the things we wanted to make sure this time is that we are really on time. So we would like to request all of you to be seated where you are and tell a few words, of what you feel at this point of time about the conference that we're just going to, get started. So we start with Dr. Daniel first.
In fact, I think the openness to trying to raise the level of the science within Ayurveda is what will ultimately result in its finding its place within the world in general. You heard, in fact that the Chinese medicine seems to have already found a place. And I think that if we're going to get Ayurveda we're going to get people to understand it, we must test it appropriately. That is my mantra, and I will keep saying it.
I'd like to request Professor Suntek to say a few words.
Yes, thank you for inviting me here to this place. I think also that Ayurveda with the new techniques has a really big, great future, and especially if you think about the new techniques of microbiomics and we consider gut-brain axis, that is an exciting model for understanding of ama and agni, I would say today, and I guess now we start to have a link between modern science and also the old science of Ayurveda. Thank you so much for inviting me.
So now I would like to request Mark Rosenberg to say a few words.
Thank you very much. It's a great pleasure for me to be part of that conference. I'm a director of an academy, so more an educationalist. And our vision is, of course, to encourage our students and persons seeking for help in Germany and in Europe. ABP, this institution, is a model and an example for us in Germany, as it has implemented the holistic aspect of Ayurveda in a way where we from Germany really feel it is done in the best way. Spiritualism and science are coming together here, and that is what is impressing, because it is practically working. All students came here at the feeling of here we can learn Ayurveda from the root up to the scientific aspect of it. So I hope that this conference, I'm sure that this conference is another step to encourage youngsters here in India, but also in Germany, to move forward with this holistic science and wisdom. Thank you.
Yes, I think the development of Ayurveda in the world, in the globalized world, is a part of the whole process of globalization. So in the Western science, we have the focus on quantities. And in the Ayurvedic tradition, we have the focus on qualities. And if both aspects are really coming together, and we try to develop research on this international level standards, I think we will have a good future for Ayurveda.
I want to say thank you to everyone here for organizing this wonderful conference with a great vision. It's extremely important. Our guest of honor and the chairman said two very important things: that we need to raise the standard of Ayurveda research, and we need to search in every place to improve the quality. I really welcome those remarks, and I hope the whole conference will fulfill them. As you may know, I'm a theoretical physicist trained at Cambridge and at MIT. I work in the biophysics of all systems of complementary medicine, particularly all the Ayush systems, Ayurveda, Yoga, Unani, Siddha, and homeopathy. There are none of them which cannot be given a theoretical basis. And all of which provide great and deep insights into life. Oxford University's Dennis Noble said recently, there is no theory of life in Western science. There are small theories of bits of biology, but I tell you, Ayurveda has a theory of life. But we have to decode Ayurveda to show it to the Western world. Bringing the theory of Ayurveda and showing its rigor, its depth, and the full extent of its wisdom is as important as showing that the Ayurvedic medicines have been standardized and that the clinical practice is rigorous and efficacious. Thank you so much.
I think from my side a few events like this are very important to promote Ayurveda worldwide, because I think it's a big need for Ayurveda in the whole system of especially Western medicine. And why? Because Ayurveda is characterized by humanity more than other old systems. And so I think that humanity is the big need for our technical medicine worldwide.
Thank you. I think this conference is a very good example of the empowerment of Ayurveda in designing and connecting its own research as a research institution, and I look very much forward to see progress. Thank you.
On behalf of the organizers, the patron, the partner organizations, the sponsors, I would like to thank all the delegates who have come across from different parts of the world to make this occasion a big success. And I thank especially Dr. Abhimanyu Kumarji, Dr. Daniel First, Dr. Horst Sunter, Dr. Ludwig Krampus, Martin Medvedev, Mark Rosenberg, Dr. Alex Hankey and Olivier Talpi. I also thank all the delegates who have taken their time to come early in the morning. I thank one and all. I also thank all the people who have helped us to host the event, and we will move on to the main sessions immediately. Thank you all.